Hello student, I am Dr. BK Barun from Medico Patna, and the today class is related to cardiac cycle time and ECG. So what is cardiac cycle time? So the cardiac cycle time is around 0.8 second, and these are divided into three parts. The 0.4 second is joint diastole, and 0.1 second atrial systole, and 0.3 second ventricular systole. So these are the cardiac cycle, and atrial systole is 0.1, so atrial diastole is 0.7 and collectively 0.8, and ventricular systole is 0.3, so ventricular diastole is 0.5, and that is the collectively 0.8 second. So the atrial diastole means ventricular systole plus joint diastole, and ventricular diastole is joint diastole and atrial systole. So these are the cycle, and this point is A, this point is B, this point is C. So this point there is a production of first heart sound, that is love, and love heart sound is produced due to the closure of tricuspid and bicuspid valve, that is AV valve, and dove sound, that is second heart sound, is produced due to closure of semilunar valve. So the love heart sound, first heart sound, is produced at the beginning of ventricular systole, or at the beginning of atrial diastole, or at the end of ventricular diastole, or at the end of atrial systole. But dove heart sound is produced at the beginning of joint diastole, or beginning of ventricular diastole, and end of ventricular systole. So these are the first heart sound and second heart sound, and duration of first heart sound is large, so say love and then dove, and duration as dove is small. So the frequency of love is larger, love, and frequency of dove is smaller. So 0.16 second time taken for the love, and dove is 0.1, 0.16 love and 0.1, that is dove. And the love and dove duration is 0.3 second, but dove after love, then the time taken is 0.5 second. मतलब लव के बाद डब 0.3 सेकेंड में आएगा, और डब के बाद लव 0.5 सेकेंड के बाद आएगा. सो दिस इज द ड्यूरेशन. एंड सेकेंड इज द ECG. ECG इज द इलेक्ट्रोकार्डियोग्राम. तो जो ग्राम है वो ग्राफ है, जो ग्राफ लिख रहे हैं वही ग्राम है, और जो इंस्ट्रूमेंट है वही ग्राफ है, और इंथोवान इसको दिया था. तो दीज आर द 3 इलेक्ट्रिकल लीड्स. सो फर्स्ट लीड, सेकेंड लीड, थर्ड लीड. So first lead, that is the right and left wrist, and third lead is left ankle region. So these are PQRST curve. So the P and R and T, these are the positive wave, and QS is negative wave. So the P curve stands for the P wave, that is the generation of action potential at SA node. So this is the SA node, generation of action potential, and it follows by atrial depolarization. And PQ means contraction of atria, and the QRS complex means ventricular depolarization takes place, that is ventricular systole. So Q to R means transfer of impulse from SA node to AV node, and R to S means transfer of impulse from AV node to Purkinje fiber via bundle of His, and T waves means ventricular repolarization, that is ventricular diastole. So this is atrial systole, P to Q, QRS ventricular systole, that is ventricular depolarization, and S to C, this is the ventricular repolarization followed by ventricular diastole. Systole means contraction, diastole means relaxation, and these are the normal ECG curve, and total time taken is 0.2 second in this part, and 0.4 second from Q to this part, and 0.2 second this part. So total is 0.8 second, and next wave again start from this point, P wave. So this is the 0.8 second cardiac cycle time. This is normal ECG, but in case of myocardial infarction, the ST segment is elevated, and the blood pressure is, the normal blood pressure is 120 by 80 mmHg. So 120 is the systolic pressure. That means ventricular contraction starts. So this is the greater pressure. And 80 mmHg, that is the diastolic pressure. Third is next is regulation of heart. So heart is regulated. First is myogenic regulation, its self-regulation, because SA node, AV node present in muscle, and its self-regulation. This is myogenic regulation. And second is the neural regulation and hormonal regulation. So neural regulation, that is the center present for the heart rate or heartbeat is present in the medulla oblongata. So this side. So medulla oblongata consists CAC group and CIC, cardiac accelerating center, cardiac inhibitory center. So CAC excited the adrenaline hormones and increase the heart rate, and CIC, that is it regulates the vagus nerve, and with the help of acetylcholines it decreases the heart rate. Adrenaline or noradrenaline. Adrenaline is the emergency hormone. It increases the heart rate. And normal condition there is a noradrenaline. And thyroxine is also regulates the heart rate, because thyroxine increase the adrenaline. So thyroxine also increases the heart rate. And sodium potassium is inversely proportional to heart rate. If sodium potassium increases, heart rate decreases. And calcium ion is directly proportional. If calcium ion increases, then heart rate increases. But in case of the youngest individual, which is mentally, physically, clinically, social well-being, and the heart rate is inversely proportional to blood pressure, but it is not followed in all individuals. And next is the disease. First is hypertension. Hypertension means normal BP is 120/80, and if blood pressure increases 140 systolic, 90 diastolic, and greater than 90, greater than 140 systolic, this is called hypertension, and it affects the brain, kidney as well as heart muscle. And the next is called CAD. CAD includes the coronary artery disease, and it includes the cardiac ischemia. This is also called atherosclerosis due to less supply of oxygen and due to deposition of calcium ion, cholesterol, and fibrous tissue, calcium ion, fat. So this causes the ischemia because it forms the atherosclerotic plaque. So there is a formation of atherosclerotic plaque, it causes the ischemia. Next is called cardiac arrest. Cardiac arrest means that is a no supply of oxygen to the heart muscle, and that is the cardiac arrest, that is the death of the person. And myocardial infarction means there is a death of the cardiac tissue, cardiac muscle, that is also called heart attack. And during heart attack there is a increase the troponin. Troponin is three types, C, I and T. So this troponin C and troponin I and troponin T present in the blood. So this is the confirmatory diagnostic of the blood, that is troponin test. If troponin is positive after 5 hours, 6 hours of the heart attack, then there is a confirmatory diagnosis of heart attack. But initially troponin is negative. So next is called angina. Angina is the chest pain, mainly in left side, due to less supply of oxygen, less supply of the blood. So it causes the chest pain, and pain also in the neck region, and mainly left region of the chest. And next is heart failure. Heart attack is another thing, heart failure is another. Heart failure means less efficiency of the heart. That means the stroke volume, transfer of the oxygen is less. So heart not work properly. So this is called heart failure. So these are the disease related to the circulatory system. Thank you.